SI joint is a very complex joint because it moves up, down, left, right, side to side. So anything we do activity-wise, moving, sports, walking, golfers, any type of twisting activity, the joint can get stuck in certain motions. And what happens here is your muscles in the low back, the muscles in the glute region, the muscles in the lower legs, all attach to the SI joint. So your muscles are very smart. They supply a function and they also protect. So when the SI joint slips, the muscle seize up, and this is extremely painful. So golfers, for instance, are using the motion of basically swinging and driving the pelvis to one direction. And what happens is that continuous motion of twisting, it causes the SI joint to actually misalign. And when the pelvis rocks back posteriorly, the muscles will seize up and protect. A lot of people have their back go out of them for that reason. We're gonna break up the little adhesions in the muscles. We're gonna break up the individual fibers so they're not shortening anymore, and I'm gonna set the joint. So what I'm gonna do is I'm gonna lengthen that muscle first, and we're gonna set that joint back into place. I'm gonna use some cupping, okay? This became really popular this year in the Olympics. Michael Phelps had it on his back. He won a few gold medals to loosen the muscles out properly. What cupping is gonna do, it's actually gonna allow the muscle that's shortening and protecting to go into the cup, and I have some lotion on her back. And just basically gonna distract the muscle fibers so we can lengthen the shortened muscle so we can get a better adjustment. So right now, we're trying to tell the body to get the blood flow to go to the area, telling the body to stop protecting, and we're gonna set that joint back in place and allow this patient to get back to her normal function. Usually it's around 2 to 4 treatments to get someone completely fixed right there, but it also depends on their activity they're doing after. So they just don't want to go ahead and run or do any type of jumping, type of brisk walking after treatment, because what happens, their muscles are going to on guard and they're going to go right back into protection.